Okay, brilliant. So, oh, sorry, just letting people in still. Yeah, so this is our topic for today. So we've got it in for an hour, but equally, I'm not dashing off anywhere other than to find lunch at 1 o'clock. So I'll make sure it's all done within the hour, obviously. But if anybody's got any further questions or want to hang back and ask anything, then do feel free to do that. So, sorry, just letting people in. Yeah. The reason for the clinical picture, there's two reasons for that actually. We do, or we have done quite a lot of work. So there's probably a few people from veterinary practices in the room today, because we actually did a large survey of veterinary practices last, well, 2023, early 2023, because there was a huge challenge with mental health within that sector. So that's where the picture comes from. But also, which I'll share with you in a minute, my background before Gateway was working in what is still the UK's largest, well, now group of mental health hospitals. So again, I've seen it from both sides. Obviously, I'm not clinical. I'm a HR professional. I'm definitely not a mental health professional, but lots of things around that. So just to share a little bit around why mental health is so important to me. Obviously, there's lots of statistics. A lot of you are probably aware of them, but I will share some of them later on. If we're looking at it from a kind of organisational and HR point of view, then actually, if we don't do something to support mental health, and we'll clarify what we mean by that in a minute, then even if we put kind of ethics and morals to one side just for a minute, it has a huge impact on organisations and how you do whatever your organization does, so support your clients, customers, patients, whatever that might be. Sorry, just check. Sorry, I could hear somebody else then. Yeah, so my first experience with mental health, which was, I was thinking about this earlier, was 30 years ago now, when a very close family member who used to work with in McDonald's, other fast food restaurants are available, but you get the idea of the kind of age at that point. And I got a call from his manager, who was also my manager, saying, "Oh, he's really poorly. He's been rushed to hospital." So I thought, "Oh, at that age, at 16, I'm not sure I was even aware of mental health." I was like, "Oh, well, what's happened?" And like, "He's been sectioned." And I remember thinking, "What's that?" Um, and that was my very first experience. And I still remember thinking, I still don't know what that means. And interestingly enough, he, if lucky is the right word, ended up at St Andrew's Hospital in Northampton, which I then worked at 6 years later. So it's all very spooky. But like I said, the largest mental health hospital or group hospitals in the UK. But I still remember to this day so clearly thinking, what is that? What does that mean? What's, for want of a better word, and I can say this because he's, my sibling, what at that point, what's wrong? What's wrong with him? What's happened? And that started a journey that is still going on today, 30 days, I wish, 30 years later. So that was my very first experience, which is mainly around, I genuinely don't understand what's going on. What is this? How's this happen? What does it mean? How as a family at that point, not as an employer, how can we support him? And then I've had my own, and again, I'm always very, very open with this. I've had my own journey with mental health, had postnatal depression after our second child. And then when the menopause kicked in, that was one of the main things around that. So I've got quite a lot of personal experience in this area, which is why I think it's so important. Because you can, and obviously I'm not going to ask you to share anything within this session, but you can feel incredibly lonely if your mental health is not where you would like it to be. So I just think within the workplace, if we forget about for a minute the impact it has on the organization in terms of costs, thinking, do you want people in your workplace that are not feeling well? Or can we do something about it? Or ideally, not always possible, can we prevent an issue happening in the first place? Quite often it will be something that's not related to work. And it might be more of a clinical kind of chemical issue, which was the case with my brother. But in a lot of cases, as an employer, we can at least support, even if we can't attempt to prevent in some way. So that's my main interest. So quite a lot of years ago, I did my mental health first aid when it first appeared. And then I was thinking this yesterday, I think about 6 years ago, we got our own mental health champions course accredited through the AQA. Because don't get me wrong, I think mental health first aid as a concept is brilliant. But what we wanted to do is focus as much on the prevention side and the culture around that. So we still look at obviously obviously we can't call it mental health first aid because that's copyrighted, but we still do that aspect in terms of how do you support people when they need them, because that is a big part of being a mental health champion. But actually, what can we do as champions or as an organization, sorry, just letting somebody in, to support people? Or what can we do in the workplace to make it at least, hopefully, that work is not going to be what causes a mental health issue. So that's kind of the background around that. Oh, let's get the slides to move. So what I'm gonna do my best to cover in the time that we've got. Obviously, it's a huge topic, but we're going to start in a minute by what do we actually mean by mental health, and looking at some of the causes or potential causes of the decline in mental health. And I'm sure that's not news to anybody within the room in term. And again, there's lots of different reasons for that, and some of which we'll have a look at. Mainly from the point of view of thinking, actually, if some of them are something that we as an employer could maybe help with, it's going to prevent some of that absence. Understand the impact of stress on mental health, very relevant within the workplace. And when we get to that bit, it'll be really interesting because, you know, stress is a word that we all use every day. It's kind of like an everyday word. But if we look at the kind of medical definition of stress, it's not a word you'd want to be using every day. And quite often we're probably not, you know, I'm not going to be pedantic because it's just language, thinking actually, is it stress or is it something else? Looking at some of the signs of mental distress for yourself and others. Again, some of the feedback we've had around mental health champions is that actually the people who did it found it as useful for them, looking after their own mental health as well as supporting other people. So just some of the things that you could look out for in yourself or others, regardless of whether you're a mental health champion. Just thinking, right, well, things to be aware of, and particularly if you're a line manager. And then, you know, probably the most important bit, looking at some strategies, ideas for promoting mental wellness. There you go. That's the first within your practice. That comes from when we've done this with veterinary surgery. So within your organisation. Okay, so that's our plan. So what I'd like to do, if you're happy to, is just to pop in the chat. What does mental health mean to you? What is it that we are talking about? Let me just unshare so I can see the chat. Just check we're all on the same. Doesn't need to be a beautifully written definition, but what does it mean to you?
They'll send us the slides.
Yeah, how we're feeling. I like that. Yeah. Anyone else? Good. Overall well-being, key component. Yeah. Internal well-being. Brilliant. Great. Love it. Some really good things there appearing in the chat. Because sometimes it's about understanding that we all have health and well-being. And you can kind of divide that into two areas. We have our physical health and well-being. Sorry, just letting somebody in. And we also have our mental health and well-being, both of which can be at different levels, different conditions at any one point. Sometimes, as we all know, it can change during the day as to how, you know, using some of this, how you're feeling within that time. And that's where sometimes when people worry about, oh, I'm not sure if I should be a mental health first aider or first aider or champion. Oh, I wouldn't want to. I've heard people say a few times, I wouldn't want to do more harm, more harm than good. And sometimes when people ask that, I say, well, actually, if you think about it, you know, when we think about physical first aid, I don't know why, I always use the example of somebody breaking their leg in the office. Touch wood, nobody has broken their leg in their office, in our office. But if somebody broke their leg in your office or in your factory or wherever that might be. As a physical first aider, your role is to make sure they're comfortable, make sure they're not going to come to any other harm or anybody else. Call, if that be relevant, call an ambulance, keep them comfortable until the clinical professionals turn up. It's not your job to x-ray them. I know you say this with vets as well, even though you probably have an x-ray machine. It's not your job to x-ray them, plaster it, whatever it might be. And it's exactly the same around mental health. Because obviously people train, like I said right at the beginning, and I'm always really clear with this, I'm not a mental health clinician in terms of profession. Obviously, I spent a lot of time and research around it as a HR person. But if you're a first aider or a champion, again, is if somebody reaches out to you for help or you reach out to somebody because you have concerns, again, it's about having that conversation. How can I help you? Is there anything that we can do? A big thing within mental health is around signposting. So helping somebody to find the support that perhaps they need, or maybe encouraging them to go and, see a doctor. Use, if you have one, an employee assistance program, things like that. So I always like to cover that off sort of quite early on, because you're not expected to, and quite rightly, like some people say, actually, you could do more damage by trying to solve somebody's mental health challenge. So yes, signpost them, yes, support them, but it's not your role to do that for them. So, okay, let me just, excuse me, bring the slides back. Okay, so, yeah, so just a few definitions on here from different types of organ. I always do like one from the dictionary. Person's condition with regard to their psychological and emotional well-being. Good mental health means generally being able to think, feel, and react basically in the ways that you want to. So feeling in control of your decisions, what you're doing, what you think of things, etc. And then from the World Health Organization as well. So lots of different definitions, but I really like what we had in there in the chat. Lots of things about well-being. How am I feeling? Obviously there's lots of things around, it's okay not to be okay. And actually recognizing that and letting somebody in, having the support around that. Okay. So here we go, as promised, and then we won't dwell on these because otherwise your mental health will be in a lower condition than it was before you joined us this lunchtime. So this is probably, maybe the actual figure will be a surprise, but mental health as the leading cause of absence has been the case for, I think, over 10 years now, depending which reports you look at. So previously it used to be, kind of neck, back, back injuries, things like that. I think that's still number 2 if there was such a thing as a chart. But it has been around mental health for, I would say, at least 10 years now. So attributed to mental health conditions, including stress, depression, and anxiety. This was actually in a couple of articles last week. I think it was, or the week before, for those of you in HR who get, I think it was people management, but don't quote me on that 1 million fit notes were issued last year in relation to mental health. And again, what we always need to remember is, which we'll look at when we look at kind of signs and symptoms, that may not really cover the amount of ill health in relation to mental health, because sometimes the person's not aware, and we'll cover that, in terms of they might notice physical symptoms, but not link it back. But also, sadly, there is still, it's certainly much better than it ever has been, some element of stigma around mental health. So some people will not ask for help, or certainly wouldn't go to get a fit note because they wouldn't want that for various reasons. So that equates to about 17.5 million working days lost. So that's a huge impact, not just obviously to individuals, but to the organisations they work in. This is from the CIPD, that's last year now actually. Most common cause of long-term absence, and long-term absence are usually defined as 4 weeks or more. And again, I read some statistics a couple of years ago, particularly around mental health and how the, obviously whatever they do in the background to work this out, that once somebody's been off for, I think it's something like 29 days, the chances of them ever coming back to work pretty much kind of drop off a metaphorical cliff. So it's thinking again, as employers, firstly, what can we do to hopefully that people don't go off sick at all, because we want to look after them. But even when somebody is off, with the right level of support, obviously, is there anything we can do to help them come back to work? Whether that's come back to exactly the same work, different work, phased return, all the things that, we won't go into that today because that's almost another topic in itself. Thinking, what can we do? Because again, something that we see quite often is that if somebody's off long-term sick, not just mental health related actually, but if we focus on mental health now, sometimes managers and employers are thinking, oh, well, I can't contact them. I'm not allowed. Thinking actually that might be exactly what's going to help them. That they know that they're missed by their team members. Obviously, agree that with the person. what what level of contact would you like? And if somebody says, I don't want any, I just want this time, then obviously you respect that. But equally, I've seen cases where sadly, somebody's felt really, really isolated, which kind of added to the stigma. So it's like, oh, it's like they've forgotten me, or they don't want to talk to me, or whatever that might be. Whereas actually the employer thought they were doing the right thing. And it's just linking up that communication. So another thing we see quite often, sadly, which is more kind of the negative side, is when people say, "Oh, oh well, I've seen that person out. I saw them in Tesco." It's like, yes, they are allowed to leave. They are allowed to leave the house. It's very different to the classic. They said they'd broken both legs, and I saw them skiing. That's a different conversation. um, but again, it's thinking actually that may well be the best thing for us. So again, if maybe you've got social events or things happening at work, if you have got somebody who's off, to ask that question. It would be lovely to see you. Would you like to come along? As with so many things, well, in life in general, but particularly around HR managing people, it's about getting the communication right. Because otherwise, that's when things get misinterpreted, taken the wrong way, etc. Some figures from Deloitte. That's an enormous figure, £56 billion a year in terms of the cost, and that's gone up significantly since 2020. And I do believe something major happened in the world in 2020, so that may well explain one of the reasons behind it. Okay, so like I said, I'm not going to do anything more on the figures at this point because I said I can't imagine many. That's a huge surprise to many people within the room. But again, and we'll look at this a little bit further along. If you're responsible for, well, certainly responsible for people, or perhaps some of you in the room who are maybe in HR, maybe fighting to get funding to do some things around mental health. You've got some great ideas. I'd like to do these kind of things, and the funding's not there. Then these can be some very useful figures to share. So actually, okay, we might, and I've got some more statistics later on in terms of return on investment for you. Thinking actually, we could, spend this money and actually save save money in terms of people, hopefully not going off sick. Maybe if that is the case, how can we get them back to work sooner? Which is obviously the best thing for the individual, but again, for the business. So okay. So stress, I mentioned this earlier on. So this deliberately put this one in here in terms of the definition. It's the one that we always use. It's the one that would be used potentially if we end it. Well, not we. I'll rephrase that. If there was a tribunal case around stress. So, like I said, it is a word that we all use a lot. Usually, we use it in terms of maybe feeling overwhelmed, overworked, too much to do, etc. But stress in itself is technically an illness. So the HSC associated that it's the health and safety executive. So this is their definition. And quite often when we think about health and safety, we think of slips, trips and falls, etc., working at heights. But there's a big H in health and safety, which is the health side, which is where this comes in. And the key words within this are the adverse reaction. Because some people say, oh, actually, I thrive under stress. Give me a deadline and I love it. I will leave it, not me personally, but I will leave it to the last possible minute, and that's when I work at my best. So actually, that's not stress in terms of the technical definition. That's your chosen way of working. That's what works for you. Does that make sense? So it's the adverse, and adverse is the key word there. So you're not having a good reaction to whatever's being placed upon you. Adverse could mean all sorts of things, but related to health. Next important word, excessive pressures. So again, carrying on with that example, if we're, if we love a deadline, we tend to leave it almost to the last minute. But actually, if you have lots of deadlines, that will be excessive, and that level of thriving under that will disappear. Within that, or it says excessive pressures or other types of demand placed upon the individual. So when we think of work, we quite often think about workload, the amount of work, the amount of time that we have to do that work, but it might be the type of work. Like I said, my last role before Gateway, which to be fair was 17 years ago, but when I was at St Andrews, there were very, very strict, quite rightly, rules around in some cases, the amount of time that any member of staff could spend potentially with certain patients because of how demanding they were. So I was thinking, yeah, we rotate staff, we have high levels of supervision, etc., etc. So that's not necessarily workload, but it is the type of work within that. I mentioned about doing work with vets. The report we did last year, the biggest source of kind of pressure was actually the behavior of clients. But as we say, not the furry ones, the ones that own them. So again, not necessarily workload, but pressures at work in terms of, as we know, we all love the great British public. We are part of it, but they can be challenging. So the pressure that comes with that. Okay. So the HSC, this has been around for a long time now. They say there are 6 main causes to stress, or causes of stress. In this case, in relation to work. If you ever want to do this as an exercise with people, we do this quite a lot. We've done it with teams where we get them to, it's almost like a little bit of therapy on, and obviously it involves post-it notes, 'cause I'm a trainer. Get them to write a cause of, we use the word stress for now for easy language, 1 per post-it note. And then you reveal these 6 causes and say, can you fit every single one of those under one of those 6? And touch wood, in kind of the 10 years, we haven't found a post-it note that doesn't fit under those 6. So the HSC did a good job. So first one, demands. So workload, work patterns. So again, it might be around the shift pattern, and the work environment as well. Control. How much say the person has in the way they do their work. We can have both ends of the spectrum then. So for example, people talk about being micromanaged. That can be, again, I'll keep using the word stress because it's within the context. Actually, people might find that very stressful. I can't make my own decisions. I can't do anything without somebody watching over me. But equally, the other end of the spectrum can be the same. I'm never quite sure if I'm doing a good job. So you've got micromanagement and then you've got no management or support at all. Brings us the next one, support. So encouragement, sponsorship, resources provided by the organisation or the manager and colleagues. So do you feel supported at work? Are you encouraged to do a good job? Are you recognised when you do a good job? And just as importantly, is it recognised then when perhaps you're under pressure and does somebody say, are you okay? Can I help? Is there anything I can take off you within that? Relationships, really important. So you've got 2 sides, if we're looking at an organisation as a whole, do they make sure that they're generally positive working relationships? And if they're not, is conflict dealt with or is it left to fester? And people, you hear a lot about people working in toxic environments. If the organisation is aware of that, what are you doing? What are you doing about that? Because it will be having an impact on individuals and it will certainly be having an impact on the performance of the organisation. Role, do people really understand what they're there to do? How do they fit into the bigger picture? You'll see some of these fit quite nicely. If those of you know around engagement, they fit quite well as well. And what happens if we've got conflicting roles? What am I supposed to do? And then the bottom one, the old favourite around change. But interestingly enough, not change itself, it's how well it's managed. Because change happens all the time. It is the nature of life and work and business. But the element that can cause stress is when it's not managed very well. So do people not know what's going on? The classic, the kind of rumor mill is communication not very good. So people are making their own, forming their own opinions on what's really happening, why, and what does it mean. So those are the 6. And the reason I've shared that today is it can be a really useful tool to look at, either for yourself, if you want to do it for yourself, or as a team, or within an organization, thinking, "Hmm, is there any of those we could do better?" Whether that's just on a small basis, thinking about yourself and your team, or perhaps as an organization. Because people will know, and again, there's always lots of stuff, not just in the HR press, but just generally around um, toxic workplaces. Well, actually, you can do something about that. It's not a quick fix. Thinking, actually, if we're aware of that, why on earth would we allow that to continue? If there are conflict, if there are managers who are not particularly good at managing, well, let's help them to be better managers then. So they can offer that support, that encouragement. If there is conflict in their team, they know what to do about it, and they can do something with it. And looking at workload, what's realistic? Do we need more people? Do we need to find a different way of working? And the environment, lots of different things. And as I always say, people, if you're really brave, you don't have to label it as causes of stress, but go out and ask people, what could we do differently? What could we do better within that? And who knows, it could be a few things that people, and like I said, we'll look at some of the stuff around return on investment shortly. But it's the classic, it might be something that for whatever reason you're not aware of. Think, oh, well, we can do something about that. That's not a problem. But again, if you don't ask, you'll carry on not knowing. Okay. So what we're going to have a look at, so I just drop a piece of paper on the floor, is some of the things that might be potential signs of stress and or mental ill health in individuals. And I think, again, maybe we'll do this in the chat. Maybe if we do the 3 separately. So let me just undo the screen share for a minute. Let's get the chat back up. Yeah. So what do people think in terms of, let's go for emotional. What kind of things might you see, observe in yourself or in others that kind of fits under that category that might make you think, yeah, maybe if it's somebody else, maybe I just need to check in with this person and check they're okay. Or you might notice it in yourself and think, oh, what's driving that? So just chuck things in there. Yeah, good. Withdrawal, yeah. So not getting involved in things yet. Teary, short fuse, quieter than usual. Outbursts, yeah. I'm always careful not to say good at this point because that makes it sound like they're really good things to see, but as in they're good. Quiet and withdrawn, yeah. Yeah, brilliant. And the thing is, with lots of these things, it's about what's noticing a change. If we're talking about somebody else, noticing a change in somebody. So, if somebody's normally very kind of chatty and involved, so, the classic kind of team meeting, they've always got stuff to say, always really involved. And then you think after the team meeting, oh, let's pick a name, Jane. Jane didn't say anything in that team meeting. Maybe I should check in. And it might be that you check in with Jane and she's like, oh no, fine, I'm just a bit tired, or I didn't have anything to say today. But actually, just by checking in with Jane, it makes her feel valued and knows that actually you would notice if there was something wrong. Or perhaps Jane will tell you that there's something going on, and she needs some support or guidance. So looking for changes. I've just seen on here, yeah, I like that. And again, this would, if somebody, Ali's just put late, unorganized and not coping with workload. So if that's a definite change, Thinking, right, what has caused that? And it may well be that the workload has increased, or it might be the workload hasn't increased, but that person is struggling. So when they used to be, super organized and always on time, that's starting to slip. So lots of different things. And quite often it's thinking, actually, if you're noticing 2 or 3 things, it's definitely worth having that conversation. Or if it's for yourself, maybe speaking to somebody, asking for some help. Yeah. So lots of things. So emotional, again, I've seen them all coming up in the chat. Tearful, outbursts. So again, all behaviors have a spectrum, and everybody's different. So some people, it might be the same emotion that somebody's really angry about something, but one person, you would get those outbursts. Somebody else will get very tearful. It's the same emotion, but how they show it, is very, very different. And then we've kind of blended the two, which is good. And then behavioural. So things like again, if somebody's normally, or always on time, always very organised, doesn't let things slip, and those things are starting to happen. Quite a few people have put about withdrawing as well. So again, the person who's normally the first up for a social event, or going out for a walk at lunchtime, and those kind of things stop. So lots of different things, which I always say is just always worth that conversation. Or for yourself to sit back and think, oh, is there something something not quite right here? Okay. And then next one, how about, and apologies if some of you already put those in, because in a good way, there's been lots of stuff in here. How about physical changes or symptoms that you might see in yourself or others? Gonna- yeah, good. Headaches, tiredness, yeah, weight gain or loss. Go either way. Yeah. Yes, change in sleep habits, so tiredness, which can be caused by sleeping too much, because that can make you feel more tired, ironically. I'm sure clever clinical people could answer that one, or not being able to sleep. So you're not having enough sleep. Yeah, what else we got? Low energy, changing in eating habits. Yeah, using painkillers, a change for themselves. Yeah, brilliant. Yeah, and again, another one, yeah, so lack of, or a change in kind of their appearance, literally. So it might be about weight gain or weight loss, but again, somebody who normally, presents themselves in a certain way isn't doing that anymore. So perhaps you thinking, maybe haven't washed their hair, um, just not looking at how they normally would do. Okay, yeah, yeah, excellent, brilliant. So let me just bring the slides back to share. But I think you've done a cracking job. Yeah. Oh, get this to come along. Yeah, lots. And this is literally obviously the tip of the iceberg, which is why we did that. So I think we got all of these. And again, I'm definitely not a clinician, but the link between brain and body is pretty good. So actually, in terms of, I mean, I'm quite happy to share. If I get stressed, I will get really, really bad stomach pains. It's like, that is literally what's happening. Other people, and a few people have put around headaches as well. So sometimes somebody may or may not really be aware that what is the real issue or challenge is around mental health. So again, perhaps if you're a line manager and somebody's taking time off sick with stomach bugs or headaches or whatever it might be, not being afraid when hopefully you do return to work interviews. So actually, this is happening quite often. Firstly, usual things, which again, topic for another day around, have you sought medical advice, but is there anything else? Because sometimes these things can be a sign of something else. So is there anything worrying you? Is there anything that we can help you with? Yeah, uncharacteristic errors or drops in performance. Because somebody's not functioning as well as they could do. And then another interesting one, if somebody's usually quite decisive, just not able to make a decision, sometimes on something maybe really, really simple. Just can't do that. Around behavior, increased or reduced time at work, and the same with holidays as well. And that could be for either reason. So if somebody's not using up their holidays, is it actually that's because they've got too much work to do and they're thinking, how can I possibly use any of my annual leave because I've just got too much to do? Or it might be caused by something else that perhaps, they think I don't have I don't have a life outside of work. So what on earth would I use annual leave for? I don't want to be on my own. So I'm not going to use my annual leave because work is where I like to be, which is a good thing, but as in that people like being at work, but they do need to have a break. So again, if you're a line manager thinking, oh, keep an eye on, are people actually using holiday and having decent amount of breaks during the year? And lapses in memory, if they're usually on the ball. I have a terrible memory, so that would not be that would not be a sign. But somebody who's normally pretty much on the ball doesn't forget things, and they're forgetting things at work or outside of work. So all of these things, again, coming back to what I said about supporting people with mental health, this is not for you to have a little tick list and say, right, I think this is what's happening. But it's being aware of these things and not being afraid to have a conversation, especially if you're a line manager, but also as a colleague, just saying, is everything okay? Because it can be that one conversation early on that then sets the wheels in motion for somebody to maybe get some support and help, or for them to think, do you know what, you're right. I have had quite a lot of whatever that means, times off with sickness, or yeah, you're right. I am not quite as on it, whatever the right language would be, as I normally am. Do you know, you're right. I might go and get some help. And it could be that one thing that you've helped somebody within that. Okay. No, we don't. No, we're doing okay, which is good. So So it might be. Again, if you want to pop it in the chat, or if anyone wants to, if they're happy to, wants to unmute themselves and share, what kind of things or are organisations doing? Like I said, sometimes obviously mental health isn't necessarily caused by work, but it's thinking, what can we do to support people within that? Does anyone's organisations do anything at the moment, or do you do it as an individual, regardless of whether it's supported? Any And obviously, I've got some examples to share with you in a minute, but I just thought it might be good to see.
Hi, can I?
Yeah, go for it, Julie. Yeah.
Hi, it's too much for me to put in the chat, I'm
Okay.
afraid, so I might grab the opportunity. I work for West Lothian Council, and within operational services, we have implemented mental health support, and I've been allocated as the mental health champion for our
Brilliant.
organisation. So we've started this in February, and in part of the process of what we've been doing is delivering training. So we'd previously delivered training to managers to make sure that they're aware of the situation, are best able to kind of support staff. And I've been rolling out training to operational staff, face-to-face staff. And on the back of those courses, I've been able to offer some support and get conversations going. Our environment here is very much male orientated. It's road workers, it's gardeners, waste operatives. So probably quite roughy tufty manly men, if you get my drift. Quite hard nut to crack.
Yeah, not necessarily. Generally, and again, there's lots of statistics around this. This is not just around not being much less likely to open up, have conversations, and that's why men's health particularly is in crisis. So yeah,
it's been received, I have to say, remarkably well by the workforce, and we have regular rollouts starting from May's Mental Health Awareness Week. I just ran a full week of drop-in sessions, so I have the door open, anyone can appear as and when, we don't need to make appointments, don't need to tell anybody, and that was really successful. So we're rolling that out ongoing, but we've got a designated member of staff. It was initially for 6 months, we've passed the 6 months mark, and it doesn't look like it's going anywhere, so it's been very successful.
Yeah.
But that's what we're doing. It's very early days, but that's what we're doing.
Brilliant. Excellent. And I guess, and obviously I'm not going to ask you to share that, but I'd imagine soon you'll start to maybe see some figures coming through in terms of reductions in absence.
Yes, hopefully.
Improvements in engagement score. There's lots of ways of, like I said, I'll share some figures with you shortly, of measuring this. Because I do, obviously, we're obviously very small business, but I get this as a business owner. You have limited budgets. It's like, right, where do I spend my money? So thinking actually,
Yeah.
let's spend it where we can make a difference. Because it's the
Mhm.
right thing to do, but equally, there's always decisions around budget. So if you can, if you're putting things in and then be able to say actually, and it takes time, it's not like a week later things will be better. But if you, which most organisations will have to some level or another, statistics around levels of absence, what absence costs, types of absence,
Yeah.
thinking actually that's starting to come down.
Yeah.
Which you've got your obvious cost savings depending what you do in terms of sick pay, but also most importantly, actually, if we've got everybody at work, we can do whatever we're supposed to do as an organisation because we're there to deliver it. Yeah.
Yeah.
Oh, Gemma, did you want to add something? Sorry, I've just. No, okay. So I didn't know if that was for us or just somebody else. Okay. Brilliant. What else have we got here? Employee assistance program. Brilliant. Yeah. Again, there's lots of different versions. Obviously, there was a bit of a scandal in the press last week or the week before around one of the largest ones, but we won't go there. But what it should be is having that lots of different variations, but that people can make that usually around a phone call, and then quite often then you've got links to kind of counselling and things like that. And again, making sure that's really well communicated. So make sure everybody knows that that exists. So make sure it's covered in kind of onboarding, that there's lots of literature in relevant places, so that if and I'm quite a big fan actually of sometimes having something on the back of the toilet door. So in thinking, oh, actually, maybe somebody's worried about their finances, and again, that's what again the research around what's creating some of the increase has been around the cost of living. Because actually, well, I say actually, I'm not surprised. That is incredibly stressful. Somebody's not going to be able to concentrate on their role if they're thinking, can I feed my family? Can I pay my mortgage? Can I pay my rent? And a lot of employee assistance programs will have a financial element to that. But if not, things like I'm a trustee for Citizens Advice. But again, that's signposting, saying actually there are people who can help. I'm not a finance expert, so I can't talk to you about debt, but I can signpost you to people who can help you. So let me just put up here some examples. Okay. Ooh, to behave. Yeah. So lots of things. I mean, one of the big things, like I said at the beginning, which is getting much better, trying to remove any stigma around mental health. Like I said, you've got mental health and you've got physical health. They're both equally as important, but sometimes mental health, like I said, can have that little bit of stigma around it. So one of the big things with mental health champions is similar to what we were saying just now, running awareness events. So there are lots of awareness days, months, weeks during the year that you can kind of use that as your basis for. But actually, let's have conversations around that. And particularly if you can get support and kind of advocacy from senior level. So actually, so if people are willing to, like I said, I have no issue sharing my experience around things like postnatal depression and then menopause. Because you think, well, actually, people think, well, okay, well, if the senior leadership team are willing, and open and willing to share, okay, it's all right for everybody else. So doing that, but running different things, awareness campaigns. Like I said, a lot of stuff around men's mental health, encouraging people to talk. And different things. Really good quality, whatever you call them, one-to-ones and support for individuals. So again, comes back to making sure your managers know how to support people. So how do I have those conversations? How do I start that conversation? So we're not talking here about necessarily a dedicated mental health role. Just as line managers, how do I support people? How do I start those conversations? Training around mental health, but again, not just for managers and not necessarily just mental health champions, just that awareness for everybody. How can we best look after our own mental health and support our colleagues? Like I said, mental health champions, which is what we do. So you've still got, and I'll talk to you a little bit about that in a little while, the helping somebody when they need it. But just as importantly, how do we promote positive mental health all the time? So think about, again, what events could we put on? How can we look at, are there any areas or challenges within the organisation? Perhaps, like I say, going back to those 6 points, do you know what, we could do something about that. A really good example last year, which was from a veterinary practice. They did two main things and it made such a difference, and neither of them cost much money. In fact, one of them technically was free. Found a room, I say found, then it was a room within the practice that was just full of stuff. So they cleared it out, painted it over a weekend, classic, bought some bean bags, and it was just a chill out zone. So you're not allowed to take your mobile phone in there. And anybody can go as long as you let somebody know, oh, I just need to duck out for 10 minutes. So perhaps they're dealt with a challenging client, human or otherwise. I just need 10 minutes. And that worked really, really well. Because it just gave people that chance. And again, that permission from the whole business that as long as, everything's covered, if you need 10 minutes, go and have 10 minutes. Because actually that 10 minutes will then hopefully help that person be more effective for the rest of the day. Whereas if people don't have a little escape area, you might have issues for the whole of the rest of the day. And then the other thing they did, they reversed back to what they'd done many years ago, and then it had disappeared, is they had a definite lunch hour for everybody. So they shut the practice for an hour other than emergencies, and everybody had lunch. So everybody got a definite hour off. Again, there was more of a social element there because sometimes they sit and eat lunch together, go out for a walk. So two things, very little cost, but it had a huge impact on the mental health within the practice. So like I said, it doesn't have to be something huge. Thinking what can we do differently? Employee assistance programs, which we talked about, looking at work patterns. Obviously, there's a lot around flexible working at the moment, which is a different way of looking at it. But thinking actually, if the way we work has an impact on people's mental health, can we do it differently? Can we look at working hours? Can we look at shift patterns? Can we look at gaps between shifts, perhaps if you're in a manufacturing environment? Make sure, if possible, I know it's not always possible, but is there somewhere that people can get away from? It's a running joke in our office because I will say to people, why are you eating at your desk? It's like get away from your whatever workstation for one of it, and actually have a break. So being able to do that. So finding some space and making sure people take breaks. Okay. So again, you don't have to be a line manager to do that. Keep an eye on a colleague. So I might say to Maria, have you had it? When did you last have a break? Have you had lunch? Oh, I'm just doing, no, go and have a break. And I don't have to do that just because I'm her manager. I could do that as a colleague. Say, come on, you haven't had a break. You need to do that. But particularly if you are a line manager, making sure that people take the right breaks. And like I said, there's a lot, and again, there's a lot of good free resources out there around, if we think about cost of living, financial education. So helping people, if that is a cause having impact on their mental health, right, well, what can we put in place? And like I said, there's lots of free resources out there if budget is a challenge. Okay. So this, just quickly related to that. So this was a report, I'm sure that was Theresa May, back in 2017. Really looking at, okay, yes, this does actually cost UK economy, whatever we just said a minute ago, well, it was 56 billion, wasn't it? But that was in 2022, but costing a lot of money. So actually commissioned a report to think, right, what's causing it and what can UK economy do differently, and therefore all the businesses within it. So have it basically, as with so many things, have a plan. Think about what can we do differently. Develop mental health awareness among employees, so people recognize things early on rather than when perhaps it gets to the point where they go off sick, whereas perhaps something could have happened sooner. Encouraging open conversations and support available, again, doesn't have to have a cost to it. Good working conditions and a healthy work-life balance and opportunities to develop if that is what somebody wants to do. Having good managers, and also monitoring it, not in a big brother kind of a way, but again, having those statistics around levels of absence, so you will notice if they go up. Is there a spike in this case in relation to mental health? If you're a large organization, does it vary across teams or across departments? And think, why is that? That particular team has a much higher absence level. It might be about the type of work they do, but that doesn't mean that you say, oh, well, never mind. think, okay, well, what can we do about that type of work or that work environment? Like I said, it might be an individual within that team that is causing that level um, of impact on mental health. But to have those figures available, to keep an eye on them, but also, like I said, from a positive point of view, if you're trying to make a difference with the mental health, hopefully seeing those figures start to come down. I think it's working. It's brilliant. Keep it up. Okay. Just really quickly around being a mental health champion, we talk about, and again, this is something that you can. Somebody's joined with 5 minutes to go. Three main areas. So the first one is around awareness. So it might be that as a mental health champion, that you get somebody approaches you, which is the ideal. That's just as you would maybe a physical first aid, said, I know you're a mental health champion. I was wondering if I could talk to you about whatever that might be, or I'm struggling a little bit, or, can you recommend any help around that? Equally, as a mental health champion, you might observe something in an individual within a team and think, maybe I should at least try and start a conversation. Or you might, I said, well, informed sounds a bit Big Brother-like, but it might be maybe a line manager comes to see you. So I'm really worried about somebody in my team. I wondered if they're happy to, would you have a conversation with them to see if you can help, or if not, say, well, what could I do? Can I ask your advice as a mental health champion? What else could I do to support somebody? The action bit is like I said earlier on. It's not your role to kind of diagnose somebody, provide the support. So the stabilize is, perhaps if somebody approaches you, in a state, whatever that might be, we talked about different levels of emotions, being able to help that person. It's okay, well, I can see your distress. That's, not want to be too British about this, but let's have a cup of tea. Works miracles. But thinking then, what can I do to help this person in the immediate situation, so that then I can listen to them. So the classic active listening, which is again subject for another day, and really importantly, which we'll cover a lot, around the empathy, because as we all know, different things will affect all of us in different ways. So it's certainly not the role of a mental health champion to say, "Oh, don't worry about that. That's nothing to worry about." Well, it is, because that's why they've come to see you. So having that level of empathy. Also, the other important part with empathy, which is about looking after the mental health champion, is being able to help and support, but not to take all those issues on for yourself, because otherwise it will have an impact on your own mental health. And then the third A is the assisting. So that's signposting. So somebody, once you've had that conversation, it's around debt. Okay, well, we've got, if you have any kind of internal resource or support that you can point them to. If not, citizens advice, local voluntary organisations, things like that. Again, are there any professionals? Maybe there is funding within the business, and having that ongoing support. So checking back in with somebody. So I really hope that's been helpful. Do you want to catch up again next week? We'll see how you're getting on. Because again, it might be, and we've probably all done that, haven't we? That somebody needs to suggest help at least 3 or 4 times before you actually do it. So checking with somebody, did you get a chance to do that? No, I haven't done it yet. Okay, well, why is that? Again, none of this obviously is from a judgmental point of view. The role is to help individuals. Okay. So like I said, as promised, these are just 2 figures because they just leapt out. I'm not going completely random quoting from Australia. This was actually within the report from 2017 that I mentioned. But from Deloitte, for every £1 spent by employers on mental health interventions, they get £5 back in reduced absence. Presenteeism, which we talked about in terms of people actually being at work too much, either because perhaps they got too much work, or actually they don't want to not be at work because of other circumstances. And of course, staff turnover. Because people will leave if work is causing an issue to mental health. They'll either leave because they think life's too short for this. I'm going to go, quite rightly, going to go and work somewhere else, or sadly, perhaps they become ill and then leave the organisation. And the Australian one, just because it kind of leapt out of the report, very precise, £9.98 return based on every pound spent on mental health training. So again, if you are ever kind of battling with whoever holds the purse strings, I say, no, this is not just a nice to have and the right thing to do, which is very important. this is going to have a real impact on some of our key figures. Okay, so very conscious of time. I'm going to run through this really quickly. So, and I think I've covered this. So, mental health champions develop the skills, knowledge, and just as importantly, the confidence to be able to help someone at work in relation to mental distress or ill health. So, being able to help somebody when they ask for it or you notice something. But the reason we call it champions is be exactly that, champions for mental health. So, what events can we put on? What could we do? Could we do some training for other people? To develop their skills in this area, and also in organizations where they have multiple mental health champions, that they then obviously confidentially report back to a senior team, say we're hearing a lot of people are coming to talk to us about workload. So I think we really need to look at that. Or perhaps you're seeing a lot of people from a certain area. So there's clearly something within that team. We need to do something about that. And really importantly, we look at how do we look after you as the champion, because it could be very easy to kind of absorb everybody else's challenges and make them your own. So making sure you've got that kind of division there.